Here's why the prior authorization reform, while a necessary step in achieving future justice for those depending on government medical funding, is not and will not be enough. It will not save the individuals being subjected to testing by HHS, Health and Human Services. And the reason for that is because the prior authorization reform will only assist those on Medicare and Medicaid Advantage. It does not affect or assist or help anyone to survive if all they're on is normal Medicaid. Now, what that means is that people who get Medicaid through Social Services, Department of Human Services, will not be included because they get regular Medicaid. The only way to get Medicaid Advantage is if Social Security Administration, which is also conveniently run by HHS, determines that you are disabled. You will get Medicare, and then if your funds are low enough, you will additionally get Medicaid Advantage to cover the difference, so you get free medical care. If you are impoverished and you are getting the regular Medicaid, this will not apply to you. Now, what it was meant to do when this act was formed, and what many people probably misbelieve it to affect, is the reduction or elimination of patients being falsely denied necessary medical intervention by either AI or uncertified people. Now, if your doctor has written you a prescription and the doctor is not already on the LEIE list, I wonder what it is that causes the HHS to deem it unnecessary. If they hadn't denied me treatment that was necessary and made me pay out of pocket for years on end, at which I accepted because most of my medical care was covered. But then when I was entered as a fucking cohort in their research study when I needed medicine and I busted my ass to finally find a doctor who would give it to me, contrary to their shitty fucking decision that the natural progression cohort should just die without help, Medicaid said it wasn't covered. The pharmacist said they couldn't give it to me because it wasn't covered. And I looked the pharmacist in the eye and said, I've been coming here for years. There's plenty of times that I needed something that wasn't covered. I paid out of pocket. I'm paying out of pocket for this. They talked to the pharmacist. They went back and forth. They had a discussion. They contacted the insurance company. Oh, all of a sudden it's covered now. Because to outright deny it would have created a fucking shit fit where police would have been on site immediately because it was not a controlled substance. It was antibiotics. Still wasn't enough to clear up the infection I got, and now my kidneys are failing, but hey, one thing at a time, right? Now, the problem is, HHS decides whether you're disabled or not. They run Medicaid, at least in New Jersey, and they also run social services. Social services, when you sign up for welfare money and food stamps, enrolls you as a potential subject for a human experimentation cohort, and they will decide whether you're the cohort who gets exposed to pathogens and radiological materials and shit like that. And then they also decide whether you'll get treatment or not, whether you'll get the generally accepted standard of treatment, which is either not effective enough or too expensive, whether you'll get a treatment that is untested and who knows what that could be, or whether you'll get no treatment at all. Then they go ahead and contact other agencies. They put you on a list, they involve your insurance, and you're not able, even if you don't try to use your insurance, to get medical care. It's like pulling teeth to get fucking imaging done, and then you can't get care even for the things that they're diagnosing you with. I've been removed from 4 hospitals for sitting there and saying, I am not leaving until I get treatment, by police. Not removed by security. I won't move for security. I told him, I got diagnosed spinal damage. You want to take a risk of killing me to get me out of here? There was actually one guy who did. He had his assistant lift me, suspend me over the pavement, walk me off of Penn Medicine's Pennsylvania hospital, the first hospital established in this nation. I mean, can you imagine the founders would be turning in their grave to hear what's happened? So no, it's not enough. It's a half measure. There are plenty of times this has happened in history. I fully support the liberation of all people. It is good that slavery ended. It was necessary to end such an injustice. But the Emancipation Proclamation, if read carefully, released none of the slaves in the North. It released none of the slaves in the fence-sitter states. It released the slaves who were not under the control of that president at that time, because there had been a civil war. So the guys controlling those slaves were obviously not going to obey that. Just like the HHS department, the Social Services Department, which gives you Medicaid when they claim that you're not disabled, is not going to just say, oh, you're disabled now. Oh, now we'll give you Medicare and Medicaid Advantage. None of the research cohort, none of the victims of this genocidal experiment, which is basically a death sentence by denial of care, denial of treatment, will be saved by this. This is a good step. It's good to raise awareness. It's good to get the discussion going, but it is a half measure that saves no one. It is political posturing, and something actually needs to be done, which will affect change for the people who are being inflicted